Assalamu alaikum wa rahmatullah. Hello everyone. Our topic is about cardiac system disorders, so let's start with the outline. We will cover anatomy and structure of the cardiac system in brief, risk factors of cardiac system disorders, diagnostic measures which are used for cardiac disorders, common cardiac system disorders, and finally nursing care plan for management of patients with cardiac disorder. The heart size is a fist-sized organ that pumps the blood throughout the body. So the size of the heart is equal to the fist of the human being. The heart has four hollow chambers or cavities are called two atria and two ventricles. The receiving chambers are the atria which are found in the superior part of the heart, and the two ventricles are the discharging chambers which are present in the inferior part of the heart. In addition to a septum which is dividing the heart into two sides, right and left, longitudinally, you can see in the figure now. We have two sides, right and left. Each side have atrium and ventricle, and in the middle there is a septum which is dividing the heart into two parts. Okay, let's talk about the associated great vessels, which are essential part in the blood circulation. Number one is the superior and inferior vena cava, which is abbreviated in superior vena cava, SVC, and inferior vena cava, IVC. They are responsible for receiving oxygen-poor blood from all veins of the body. Then we have pulmonary arteries, which are divided into right and left for each lung to be oxygenated via respiratory process. Then pulmonary veins are equal four in numbers. They carry the oxygen-rich blood from each lungs, from the right and from the left lungs. Finally, the aorta, which is the biggest one and responsible for transporting oxygenated blood for all the body organs. As we see here now in the figure, SVC, superior vena cava, and inferior vena cava, of course they are colored in blue because they are carrying the poor oxygenated blood. While right pulmonary artery and left pulmonary artery are also carrying poor oxygenated blood, which is ready for respiration or respiratory process. The right pulmonary veins will have two in each side, two for each lung, carrying oxygenated blood, and then it's transferred to the left side of the heart to be pumped through the aorta later on. Layers of the heart. Actually, the heart muscle has three layers: endocardium, myocardium, epicardium. Of course, as we know, cardium is referring to the heart. Endocardium is the innermost or the internal layer of the heart. Myocardium, actually, it's the main part of the heart. It's the thick middle muscle layer. Epicardium, it means the outermost or the external layer of the heart. And actually, epicardium is one layer of pericardium. Pericardium is like a sac filled with water or filled with fluids to allow the heart to be lubricated and to keep our heart from rubbing against other organs, like a protective layer. Heart valves, we have four valves, two atrioventricular. Why they are called atrioventricular? Because they are between the atrium and ventricles. They are two mitral and tricuspid valve. Actually, atrioventricular valves are responsible for S1 or first sound of the heart, which we can hear through stethoscope. Number two is two similar valves, which are between aortic and pulmonic, and they are responsible for sound number two or S2 of the heart sound. Of course, each valve is present between specific areas, like tricuspid valve is located between the right atrium and right ventricle. Why it's called a tricuspid? Tri, it means the three flaps or three parts of a valve or three gates. Mitral valve, it's found between left atrium and the left ventricle. Of course, every one of those valves are responsible for transporting the blood from side to another side, as we from one chamber to another chamber. Semilunar valves are located between the ventricles and outflows vessels, so they are responsible for moving between the aortic and pulmonic valve to carry the blood to be ready for all over the body parts. This figure shows heart valves. As we see now, tricuspid, for example, it's composed of three flaps or three gates, while the bicuspid only two flaps. Aortic and pulmonary valves are composed of three flaps like tricuspid. How is the heart muscle itself oxygenated? Heart is responsible for nourishing all the body, but how the heart itself is nourished? We have two pathways to nourishing our heart. Coronary arteries, which is one of the blood vessels covering all the heart outside and responsible for oxygenating or transporting oxygenated blood to the heart tissue itself from the aorta. Then after the process of oxygenation, as normal organ, we have deoxygenated blood. So after delivering oxygen and picking up waste, the deoxygenated blood is collected by cardiac veins and returned to the right atrium, and further on complete the process of oxygenation via what we called coronary sinus. So we have two parts, coronary arteries, which branch it from the aorta, and coronary sinus, which responsible for delivering deoxygenated blood from the cardiac tissues. Physiology of the heart, or actually it's an important pathway which is called electric pathway. How the electricity of the heart it works. As we know, as we see here now, it's organized in numbers 1, 2, 3, 4. 1, it means SA node. This is the first point for producing electricity. Then it's transferred to the point number 2, atrioventricular AV node. Then for bundle of Hess, and finally for Purkinje fibers. So all of the time from our birth till our death, the heart is working in this way, which is responsible for continuing of contraction process. Blood circulation, actually, if we can see here, I think it's more obvious. The yellow color, the blue color, it refers to deoxygenated blood, and the red color refers to oxygenated blood. As we see here, from all the body veins, we have two superior vena cava, as we said, which is transporting pure oxygenated blood to the right atrium, then through tricuspid valve, which contains three flaps. It's transmitted to right ventricle, and then to the pulmonary arteries, which are going to lungs to be oxygenated. Then through the pulmonary veins, 4 pulmonary veins, as we see here, from the lungs after they are becoming oxygenated, is transferred to the left atrium and transported through mitral valve, which is composed of 2 flaps, to the left ventricle. The left ventricle transporting the oxygenated blood throughout the aorta. This is aortic arch. Aortic arch is, as you see now, it's divided in many tubes. Each tube has her pathway or its body organs. Okay, let's talk about diagnostic measure for cardiac disorder. Actually, to diagnose cardiac disorder, we have a lot of techniques. Starting from the simplest one, it's patient history and the physical examination, which is the initial step in our career as nurses. Patient history is usually composed of subjective and objective data, including feeling of chest pain or palpitation, syncope, fatigue, and so on. Physical examination, it's starting with sculpting the heart sound and finding or figuring murmurs. Murmurs, it means an abnormal heart sound, which is usually refers to S3 and S4. Also, jugular vein distension, which is a sign for overflows and edema and changes in vital signs like hypertension, tachycardia, and tachypnea. And of course, fever in case of infection. Electrocardiography, it's abbreviated to ECG and sometimes to EKG. Both are right. Essential for evaluating the heart electrical activity. The main two types are resting ECG and Holter monitoring. Resting ECG, it means to make ECG monitoring for supine patient and resting position, usually in the outpatient clinic. Holter monitoring, it's for continuous monitoring of the graphs or heartbeats of a human or a patient for at least 1 day to 2 days, 24 hours to 48 hours. Then later on, we have a SPC as usual, complete blood count to differentiate for infection with increased or high white blood cells and coagulation which configured with platelets, and the anemia, which usually configured with low RBCs. Cholesterol levels, it means lipids profile, which is a symptom or showing a risk for coronary artery disease and what is called atherosclerosis or hardening of the blood vessel. Thyroid levels, which are T3 and T4, they are responsible for arrhythmicity or regularity of the heartbeats. So any disturbance of these hormones causing arrhythmia or disorganization of the heartbeats. Cardiac enzymes are chemicals secreted from the heart tissue in cases of problems or affecting the heart, like myocardial injury or injury to the myocardial muscle of the heart, like what you call troponin 1 and 2, or troponin, sometimes it's called troponin T. Troponin T is an enzyme. If it's found in the blood of a human, it means he have a myocardial injury. Also, we have a creatinine kinase, or what is called CKMB. This is abbreviation. Are crucial. Both of them are crucial for myocardial injury. So mostly we found both of them in the emergency for any patient complaining of chest pain, to identify whether they have a myocardial injury or something else. B-type natriuretic peptide, or BNP, it's like biomarkers or like enzymes or like a chemical secreted in the blood in cases of heart failure, which is a killing state. Chest X-ray, as usual, it's just a plain X-ray to assess the heart size and pulmonary congestion and giving an overall image of the heart composition. For more detailed investigation, we use what's called echocardiography, and we have two types of echocardiography. Transthoracic, it means outside the chest by putting a transducer, as we will see now in the figure. And transesophageal, it means we enter a tiny tube through the patient mouth. Of course, the investigator will monitor using a screen or monitor. This item or term EF, or ejection fraction, it's one of the most assessed parameters in cardiography. It's called ejection fraction. The normal range is usually between 55 to 70%. Less than or more than, it means there is a problem in the heart. Stress testing, it means we making like ECG or monitoring or even echocardiography while the patient doing exercise, like walking on a treadmill, or sometimes in cases of old age patient or patient with leg fracture or paralysis or so on, using a pharmacological drugs injected intravenously to make an exercise on the heart, and then we can assess the heartbeats. Tilt test allowed to monitor blood pressure and heart rate when the patient laying down and standing up. It means to assess blood pressure and heart rate in different positions of the patient body. Cardiac catheterization and coronary angiography is a gold standard for diagnosing coronary artery disease. Mostly they are therapeutic or diagnostic to assess any clots or any obstruction in the pathway of coronary or heart circulation, and therapeutic sometimes if we need to make angioplasty or stent, which is the method for treatment of cardiac vessels. Cardiac CT is a non-invasive imaging. It's nearly like echocardiography and X-ray, but it's more detailed. Cardiac MR, it's the same, but using a high resolution imaging. It gives more detailed structure of the heart and function. Ankle brachial index, as we talked before, it's a test, it's a non-invasive test used to detect bad or peripheral arterial disease. Some figures. This is ECG or EKG. The most important part is that we have to instruct the patient to lie on his left side. The sonographer, it means the assessor, it may be a doctor or a nurse, moves the transducer. Transducer is the machine which are responsible for taking photographs or picture of the heart function, using, of course, what is called a KY gel, which facilitate the visualization on the screen. This is a strip or investigations or ECG. Actually, it's just to be aware that this is the waves of the ECG composed of P, Q, R, S, T. Each one of those are reflecting action in the heart. B wave revealing the activation of the aorta, or sorry, of atria through SE node and the AV node. Activation of the ventricles, which means the working of SE node and the AV node and the transporting to the other part of the heart. And then recovery, which means relaxation of the heart. So B, it's for contraction of the atria. QRS, it's mean for contraction of the ventricles. And T wave, it means relaxation or the phase of relaxing of the heart. As we see here, we can assess in general, is that normal or abnormal, like these figures. This is the normal one. Of course, it's obvious this is fast and this is slow, and so on. This is regular heartbeat. Regarding table test, it's usual, non-invasive, easy diagnosing, putting the patient in different position from laying or supine position till standing, and measuring vital signs and blood pressure especially to assess if there is any problem. Ankle brachial index, it means we can multiply ankle blood pressure on the arm blood pressure, and then we have a difference. If the difference is less than 0.9, it means the patient have a peripheral arterial disorder. Cardiovascular disease risk factors, they are divided into two parts, modifiable risk factors and the non-modifiable risk factor. Modifiable risk factors, they are means the factors that can be changed or reduced, like hypertension, hyperlipidemia or high cholesterol, smoking, obesity, diabetes, alcohol intake, unhealthy diet, and physically inactivity. Regarding a non-modifiable risk factor, it means it cannot be changed, like family history or old age or genetics, or sometimes sex, as in females. Cardiac disorders are increased after menopause, while in men is already in a risk during their adulthood. Some races, like African, they are more capable for cardiac disorder. So let's start with the first cardiac disorder. It's called hypertension. Hypertension is defined as a systolic blood pressure greater than 140 over than 90 millimeter mercury. This is based on the average of 2 or more accurate blood pressure measurements. So we can not diagnose a patient with he is a hypertensive or she is a hypertensive unless we make at least 2 or more accurate blood pressure in different time. It's categorized into primary or essential or sometimes idiopathic and secondary. Secondary, it means it's due to an underlying cause like a disease like renal failure or like adrenal gland problems or brain tumors and so on. Essential is usually regarding to unknown cause like overweight, for example, or like obesity or genetic disorder. It covers about 90% of all cases of hypertension. Classification in this table, we show now the normal value. This is a recent classification of blood pressure. The normal value should be less than 120 and the systolic less than 80. While the pre-hypertension, it means over than 120 and over than 80. Stage 1, stage 2 hypertension, it means we reach it to 140 over 90. Of course, over 180 and over 120, it means hypertensive crisis. This means intensive care unit. Clinical manifestation. Actually, hypertension is a silent killer. Silent killer, it means it doesn't cause a specific manifestation. So it's called asymptomatic. As A, it means no symptomatic. But sometimes some people or some persons with hypertension are complaining of headache, dizziness, chest pain sometimes, and blurred vision. This means that this person is in second stage or even in the crisis of hypertension. How we can prevent to be complaining of hypertension, especially if we have risk factors. Prevention of hypertension mainly relies on a healthy lifestyle and self-discipline. So we have to control our weight, because overweight or obesity is one of the mainly risk factors for hypertension. Adopt DASH. DASH diet is called dietary approach to stop hypertension. This is abbreviation. Include consumption of a diet rich in fruits, vegetables, and low-fat dairy, and also low-fat in low sodium intake. Dietary sodium retention means decreasing of all sodium intake per day. Physical activity as exercise and sports are usually improve the overall health of a human, especially if more than 30 minutes. At least for 3 or 5 days a week. Pharmacological therapy for hypertensive. The group of medication used for hypertensive is called antihypertensive medication. This is the first lines of treatment. They are called angiotensin converting enzyme. This medication are responsible for preventing of transmitting of angiotensin. This is an chemical or enzyme present in our body. It's allowing the blood vessel to constrict and so causing hypertension. So this medication are inhibiting this mechanism and allowing relaxing blood vessels and lower blood pressure. For example, captopril. Captopril is a medication which is called angiotensin converting enzyme and abbreviated ACE. Inhibitors, it means blockers. Diuretics are medication used to get rid of excess salt and water, like furosemide. Beta blockers lower blood pressure by reducing heart rate and the amount of blood the heart pumps with each beat, like atenolol. Beta blockers works on a beta nodes or beta points in the heart, which allows the heart to decrease the blood pressure and reducing the effort of the blood, and so treating the hypertension. Calcium channel blockers, it's same, it works by calcium exchanging from entering muscle cells, preventing calcium to enter the blood cells, so blood pressure is decreased by relaxing and widening of the cells, like diltiazem. Alpha blockers, also like beta blockers, relax blood vessels, making it easier for blood to flow through them. They prazosin, like a blood or vasodilators. So these are the most common line of treatment, especially in severe cases of hypertension. But in an early stage of hypertension, the patient could rely on healthy lifestyle and self-discipline, as we said in the last slide. So let's discuss now coronary heart disease, or it's abbreviated to CHD, and sometimes it's called ischemic heart disease or IHD. Coronary artery disease is a narrowing or blockage of coronary arteries which supply oxygen-rich blood to your heart. Coronary artery, as we said, it's mainly nourishing for the heart itself. So any narrowing or blockage, it means the cardiac will deprived from the nutrition, which including oxygen and blood circulation. This happens because over time plaque, including cholesterol, which is the most common one, build up in these arteries, limits how much blood can reach heart muscle and causing what's called ischemia or interruption of oxygen supply. It's including angina and myocardial infarction, and we will discuss one by one. Angina pectoris or chest pain. Actually, both names are right to describing this problem. It's caused by blockage or spasm of a coronary artery, leading to a diminished myocardial blood supply. The main problem here is the coronary artery are blocked and spasmed because of a plaque, which may be, or mostly of the time, cholesterol, leading to a diminished blood supply to the myocardial, which causing lack of oxygen and causing ischemia. So as a patient, it felt like a chest discomfort or pressure or pain in the middle of chest. Classification, stable angina and unstable angina. Classification, it means the types. The types of angina, we have two main types. Actually, we have a lot of types, but they are the most common types. This is predictable and consistent pain that occurs on exertion, which is called stable angina. The chest pain here, it occurring on exertion, so it means with efforts. And relieved by rest, and the nitroglycerin. Nitroglycerin, it's one of the medication which is taken to treat angina pectoris and improve the blood circulation to the myocardium or the myocardial ischemic myocardium. Unstable angina, It's pain that occurs more often and unpredictable pattern. It can occur anytime, at rest, in exertion, when sleeping, anytime. It's unpredictable and they may not be relieved with rest or nitroglycerin. So on the contrary, it's unlike the stable angina, it's not relieved by rest or nitroglycerin. Because of that, it's called unstable angina. So stable angina, it's occurred mostly on exertion, and unstable angina, it occurs mostly in any time and not treated or relieved with rest or nitroglycerin. Causes of angina, actually the list here is the most common causes for occurring of angina, regardless the risk factors. Like physical exertion, some people are playing sports too much, so they are increasing the myocardial oxygen demand, which is translated to or transmitted to angina. Exposure to cold, some persons are sometimes in cold weather, they are abruptly exposed to very cold weather, which causing the same problem and causing the same chest pain. Eating a heavy meal, it means increases the blood flow to the mesenteric area. Mesenteric area, it's found in the GIT system, and so diminishing the burst of blood from the heart muscles, so it causing a chest pain and discomfort. And as usual, stress causing a release of catecholamines. Catecholamines, it's hormones which responsible for making the patient in a state of stability and free of stress. Medical management, oxygen therapy is usually initiated at the onset of chest pain. In the cases of severe chest pain, the first treatment of this patient, especially in an emergency room, is oxygen therapy. Then the pharmacological therapy is nitroglycerin, which is given usually sublingual to make a rapid effect within minutes. Beta blocker, as we said before, it's working on the relaxing of the heart rooms and decreasing the blood pressure. Calcium channel blocker and so on, have a negative inotropics effect, which decreasing the heart workload and the heart efforts. And the platelet to prevent platelet aggregation, and agulent prevent thrombus formation. So formation of thrombus, it's prevented by using this drug. This is a mix of medication. Some of patients using only nitroglycerin or using nitroglycerin with beta blockers and so on. Myocardial infarction is the second coronary artery disease. So number one, it was angina. Number two is myocardial infarction, which is abbreviated to MI. Actually, it's the same of angina, but it's a more serious case. It's used synonymously with coronary occlusion and heart attack. Patient with MI, it means he have a complete coronary occlusion or a case of heart attack. In MI, an area of the myocardium permanently destroyed because plaque rupture and subsequent thrombus formation result in complete occlusion of the artery. This is the major problem in MI. Causes: vasospasm is a sudden constriction or narrowing of the coronary artery with or without causes. Decreased oxygen supply, regardless many causes like bleeding or anemia or hypertension. Increased demand for oxygen like a rapid heart rate, like in cases of thyroid toxicosis, which affecting the thyroid gland, or ingestion of drugs like cocaine, and any case increasing the oxygen demand of the heart, it may causing MI. Clinical manifestation, as usual in angina, chest pain. What is the difference between chest pain of angina and MI? We will figure it in the coming slides. This is a cardinal symptom of MI, persistent and crushing substernal pain. This is the description of patient. Persistent and crushing substernal pain. Substernal, it means behind the sternum bones. That may radiate to left arm, jaw, neck, or shoulder blades. So it's a referred pain and radiated pain. It's starting in the middle of chest and can be radiated to left side of the body, including arm, jaw, neck, and so on, and shoulder. Pain is usually described as heavy, squeezing, or crushing. This is the patient's own complaint, subjective data of the patient. It may be persistent for 12 hours or more. shortness of breath because of increased oxygen demand and a decrease in the supply of oxygen. So dyspnea, it's a common symptom in both angina and MI. Indigestion, as a result of the stimulation of sympathetic nervous system, it's like a reflex of the body, defensive mechanism of the body. Tachycardia and tachypnea to compensate for decreased oxygen supply, as here the heart trying to compensate the diminished oxygen supply to itself. Catecholamine responses the patient may experience such as coldness in extremities, perspiration, anxiety, and restlessness, as these are associated symptoms. May occur, may not. May are not okay. This is a figure shows the myocardial infarction pain, chest pain. As we see here, it's starting from retrosternal or behind the sternum in the left side, and then radiated to the left arm, neck, and shoulder. It's usually described as squeezing or crushing or heavy pain. Medical management of MI. Actually, it's not, there is a not big difference between angina and MI, but because if MI is more dangerous, we have to start early as possible. Morphine administered in the IV boluses is used for MI to reduce pain and anxiety. Because of the chest pain here is so severe, we have to give morphine. Morphine is a medication which is treated in a special manner. AC inhibitor, or as we called it previously, angiotensin inhibitors, prevent the conversion of angiotensin 1 to angiotensin 2 to decrease blood pressure and for the kidneys to secrete sodium and fluid, decreasing the oxygen demand of the heart. This is the main job of AC inhibitors. Thromboembolics dissolve the thrombus in the coronary, like preventing a lot or further thrombus. And in case if there is a thrombus, it's trying to dissolve it. Emergent percutaneous coronary intervention. This procedure is used to open the occluded coronary artery and to promote reperfusion to the area that has been deprived of oxygen. It's an urgent or emergent procedure done in the emergency room to save life. In this table, as we showed in this table, showing the difference between chest pain in angina and MI. Pain discovered in angina is described from the patient's own words, like tightness, squeezing, pressure, or a dull. Myocardial infarction, crushing, and severe. It cannot be tolerated. Duration, actually here in angina, it's usually within minutes. But in myocardial infarction, actually it may be exceeds 30 minutes and lasting for days. Triggers often occur with physical activity or stress, but in myocardial infarction, actually it can occur in any time, like unstable angina. Relief, usually relieved by rest or nitroglycerin. On the contrast, myocardial infarction not rapidly relieved by rest or coronary dilator drugs like nitroglycerin. Thank you.